quite a number of you may have your videos off, and that's perfectly fine. I'd like to have my video on. Oh, okay, Ahmed.
Yes, ma'am.
Great. So I have my video on just so at least you know you're not talking to a robot.
Yes, ma'am.
Yeah, so I'll share my screen and let me know if you can see my screen, and then we can get started. It's not necessarily a detailed slide, but I just wanted something to guide the conversation so that I don't go on and on and on. So
Yes, ma'am.
yeah, I think I'll be done with this and at least if you'd like me to go on.
Yes, ma'am. I think you can go on.
All right. So yeah, good afternoon, good evening to everybody. My name is Bawo OGUNRO. I'm happy to be here. I think this is such an amazing opportunity talking to you all as a fellow alumni. It's good to say that I've been where you are currently, and I'm happy to share anything that would help you figure out what you have in your head. I think a lot of us might feel like we haven't figured it out. For those of us that feel like we already have things mapped out and we know what we want to do, congratulations, well done. But for the rest of us that are still figuring it out, I mean, this is also a great opportunity to get some clarity to what you need. So I will start with a little bit of introduction about myself. Yeah, just before I go on, Ahmed, are you recording, or would you like me to record and send you the recording? I'm not sure if you're muted.
I'm sorry.
Yeah.
Can you hear me, ma'am?
Yes, I can hear you. I can hear you now.
So I was saying you can help us to record, but someone else is also recording. So if you miss someone,
Oh, okay. So good.
Someone else
Someone else is recording. That's fine. Yeah, that's fine. That's fine. Yeah. So my name is Bawo OGUNRO. I am a pharmacist. Graduated in 2009. So yeah, it's been a couple of years. But I'm loving every bit of being a pharmacist. I'm loving every bit of, where I am. It's such an amazing time for a pharmacist, and I will talk a little bit more about that. My experience, I've worked with pharmaceutical organizations. I worked with Sanofi, did my master's at Emory University, where I had a public health degree, worked at the CDC in Atlanta, and currently I work for Pharma. In my previous role, I was actually the country head for retail in Nigeria, but right now I'm the chief of staff of Pharma, where I'm working very closely with the CEO to ensure operational excellence for the company. But a lot of what I will talk about would revolve around my role as the head of retail for Nigeria. In that position, basically, I was responsible for managing the operations, the retail operations in the country. And what that entails basically is end-to-end. So hiring, ensuring that we're able to grow our pipeline of partner facilities, ensuring that, all the different departments that we work, that the retail business really works with, including, supply chain, finance, billing, everyone is working together to ensure that we're achieving the objectives for the retail business unit, which is to ensure that we are providing that value to our partners, and our partners are retail pharmacies. So that's a little bit about my background. Moving on from my professional background, I am the founder of Rebirth Careers. I think Rebirth Careers was founded 2 years ago in 2020. And I think for me, it just gave that foundation. Before then, I was always providing support. I always found myself in the situation where I'm either providing some advice or I'm providing some tips, or I was speaking to people and doing a lot of all the things that I'm here today talking to you all. right? But the Rebirth Careers platform provided the opportunity for me to streamline everything that I wanted to do. So I provide career advice, to young professionals. I provide advice as well, business operations advice to small business owners. My sort of focus with Rebirth Careers is growing businesses from the start up, with a focus on operations, with a focus on startup strategies. So Rebirth Careers has really helped sort of bring out that side of me that loves to coach and teach and add value to people. So that's just a brief summary of myself, my background, and then just moving on to the personal side. I am married and a proud mom of two beautiful girls. So just in case you hear some crazy screaming in the background, I've warned them to give me 1 hour of no noise. So let's see how that goes with that. But yeah, that's me. So when I'm not wearing my professional hat, I am doing my mother duties and yeah, trying to juggle it all. Sometimes it's not easy, but yeah. So back to you. Thank you again for this opportunity. I'm so grateful to be here to talk to you all. And as I said earlier on, I'm really excited to answer some of the questions you have, provide some clarity onto how it has been for me, my journey. And I'm hoping that you can pick up some insight into how you can take the next steps to having a fulfilling pharmacy experience. So class of 2021 plus one, Inferno, what next? So I'll move on to my slide now. If at any point you cannot hear me, Ahmed, please let me know, either by a comment or by just speaking.
I'll do that.
Great. And so we'll just take the questions at the end of just as a short presentation, probably be about 20 minutes, but we'll take the questions at the end. So really, when I was thinking about this, my thoughts were, are you ready? So to each and every one of you, are you ready? Because you are stepping into, really an amazing time, I must say. And I know it's difficult for quite a number of you to believe, because the economy is tough. Everyone wants to get out of this country. Everyone wants to leave. But the truth of the fact is, you need to understand that Nigeria is really a fertile ground for a lot of ideas that can spring up. We're looking at the possibility of getting opportunities outside the country, but I will tell you for a fact that opportunities are right here. You only just need to know where to search. You only need to believe in yourself, but there are opportunities. I mean, we're in the pharma sector, right? And it is such an amazing sector to be in, because one, healthcare never grows old. No matter what, even if people don't have money to make their hair, women don't have money to fix their nails, men don't have money to buy cars, they will always look for money for healthcare, right? They will always look for money for drugs. I mean, you all would agree with me that healthcare is a very critical part of our existence, right? We all want to be healthy, we all want to feel fine, and not only just in our bodies, but even in our minds as well. Now, when you're looking at Nigeria, the Nigerian pharma sector is worth $1.5 million right now. So $1.5 million is what the Nigerian pharma sector is worth. And there was a study done by McKinsey that said that the Nigerian pharma market is estimated to grow about 9% year on year and would reach $3.6 million by 2026. Where are you going to get that outside the country? There's nowhere. Africa and Nigeria is the place to be right now. And in the pharma space, there are huge opportunities to tap into this value that I just mentioned. Huge opportunities. And it's from young people, young minds such as yourself, making out time on a Saturday, right, to be on this seminar or on this work. It's such an amazing time. So with that in mind, that the Nigerian pharma sector is what is going to be worth $3.6 billion, right? in 2026. The question is, are you ready? Are you ready for that? What are you going to do to take out of that, to impact and have out of that sector, right? As a pharmacist, right? Because if you're not a pharmacist, then that's a different category, right? But as a pharmacist, are you ready? Are you ready for that impact? Are you ready for this huge growth, right? And I know that the economy is quite challenging right now. I mean, we can see that with the inflation rates. We can see that with all the craziness that is going on in the country. But I'll tell you that the ideas are right here. In 2020 alone, there was a lot of investor interest in health startups in Africa. I mean, we saw what happened with 54 Gene. I'm sure quite a number of us know that company. 54 Gene raised $15 million in 2020, in a time where the economy was going down, businesses were crumbling, a lot of craziness and chaos was happening with COVID. And then you have a company, a healthcare company, that is raising $15 million just like that in the get-go. We had companies like Zipline flourishing. I mean, we all know Zipline. They use the drones to supply medicines, pharma medicines, blood to our communities, right? Zipline and all these other companies, health tech companies, pharma companies raised a lot of money. So there were a lot of investor interest. And that interest is still there because, number one, COVID is here. COVID is not going anywhere anytime soon. Right now, Lagos State government is already piloting. Some of you may not know, but Lagos State government is already piloting giving out COVID vaccines via the pharmacy line. So quite a number of pharmacies, retail pharmacies, have been earmarked and picked as pilot pharmacies, and they're testing, rolling out COVID vaccinations. It's not going to be free. So for those of you who have not taken your COVID vaccine, please know that in a couple of months or within the year, you may have to pay for the COVID vaccine if it becomes readily available at retail pharmacies, right? So those are some of the great steps that are really, the opportunities are there, a lot of opportunities. So one, I wanted to ask you, are you ready? Are you ready for these opportunities? Are you ready to tap in? Because Africa is ripe. You go outside the country. I'm not against going outside the country, right? And I don't like, my best friend, she ran away. I always tell her she ran away to go to the UK. She wanted to relocate with her families. I don't look down on anyone, but let me tell you something for a fact. All the problems that needs to be solved are being solved in Africa, right? If you go outside the country, they don't have that many problems. You just fall into a system and you're just there. You know, you're literally in that box where every day you're doing the same thing. And I'm not to say that there's no innovation, but all the innovations really are focused in Africa, focused on developing countries, because we have a lot of problems that needs to be solved, and we have a lot of bright minds to solve them. But what we see is that these bright minds go out of the country, and then, you know, they're not necessarily solving problems out of the country, right? But they're living out. So are you ready? That is the question. We need to be ready. So I'm going to share just very quickly the must-haves, and I call them the top 3. I didn't want to go too much into, just talking about a lot of things because I didn't want it to be overwhelming. But this 3 is going to be very, very key. The first thing is your brand. Is your brand ready? Are you ready, right? Brand-wise. Right now, you're just out of school. A lot of people may not know Ahmed. A lot of people may not know Fabian. A lot of people may not know Jonathan, right? I'm just calling out the names that I'm saying on here. A lot of people may not know you, but you are at the point where you can morph yourself into what you want to become. And that's such an excellent time. Fast forward 20 years from now, trust me, it's going to be way more difficult to morph that image of what you want yourself to be. So right now, you're leaving school, you're fresh out of school. It's the perfect time for you to say, what do I want to be known for? What field do I want to be? Who do I want to be seen as? What is my brand? What do I want my brand to be? How do I want to be perceived when I talk to someone? And that's very critical. And there's certain things that you need to do in building your brand. At this point, you should start thinking, of course, about opening a LinkedIn account. If you do not have a professional LinkedIn account, you want to do that. If you do not have a professional photo of yourself, you want to do that because that ties into your brand. So imagine if someone is going to hire, say, Ahmed, I'll probably call your name like 100 times in this call. So yeah, so imagine if someone wants to hire Ahmed, right? And they go on his LinkedIn photo. First thing, if I type Ahmed Adiago and his name doesn't come up, as a recruiter, I'm already like, oh, why is he not on LinkedIn, right? That's like the first, like, I'm like, okay, why is he not on LinkedIn, right? Okay, so Ahmed's name comes up. Then the second thing is, how is he packaged himself professionally? Does he have a professional photo, or does he just have a photo of himself smiling with some funny background or a dark colored picture? You know, I see some pictures of people, and you know that like they just use their phones to take those photos. No, so if you're gonna go to a studio, it doesn't even cost that much money. With like 5-6K, you can actually just get a nice shirt, you know, look good. For the ladies, put a bit of makeup on your face, have your hair done nicely, and take a nice photo. But you need to brand yourself. So if you don't have a LinkedIn account, definitely it's part of packaging yourself and your brand. You need to ensure that you are doing that. If you do not have a well-made CV resume, you need to have that done. Even if you don't have experience, there are ways in which you can craft your resume, because you're going to be out there in the job market. You're going to be out there looking for opportunities, even as a trainee, you know, as a junior associate, or even just learning internships. What are you going to use to show, right? There's a way you package yourself and you're perceived as a professional, right? And there's a way that you package your resume, and then you are not perceived as someone who can do the job, even though you have the skill sets. So you need to have your resume. Those are some of the things that I'm talking about when I talk about the brand. So are you ready in terms of putting yourself out there, in terms of getting a strong brand image for yourself? Do you have a draft cover letter ready? So that are you aware of the etiquettes of interviewing, of talking to people? Do you have a simple introductory speech about yourself? And you don't need to say something elaborate. You could easily just say, if you meet someone, it could be a potential employer. It could be perhaps you were at an event, perhaps you attended a health tech event, and there is the CEO or the COO of a top multinational company that you were interested in working at, and you approach them. What do you say? So if you approach this individual, do you just go there and gape at them and look like, you know, starstruck or whatever? Or do you go there with just a short phrase of how you want to be perceived, right? So these are things that you need to think about. How do you want to introduce yourself? How, as to someone who potentially could offer you a position or could be of help in plugging you into different systems. So your brand is very important. You need to start thinking about that if you've not thought about that already, and start putting that in place, because that is very, very key. The second thing is the skill sets. How will you deliver? I think for a lot of us, we think that you learn on the job, but I'm sure you all know that sometimes, even when you are looking for opportunities, they want to know what you can do. What can you bring to the table? What skill sets do you have? Right now, for your generation, there is no excuse. There is no excuse, because unlike before, there's a lot of opportunities to get skill sets, learn courses free of charge. There's YouTube. Like, you can go on YouTube and learn, Excel. You can go on YouTube and learn. You can even learn Python. Like, you can learn tech on YouTube. There are courses like there are platforms like Allison. I'm sure we know Allison. There are platforms like Harvard X, where you can go and take free courses, a lot of free courses, and it's absolutely free. You sign up, you have an account, and then you are able to look at what the different free courses that they have. It could be on public speaking, it could be on making presentations, it could be whatever it is, Excel, it could be on whatever. Like, those courses are free. So there's no excuse to not be able to put one or two courses or skill sets on your resume. Right now, there is no excuse. So if you're not already doing that, in terms of trying to put your skill sets together and to say, oh, what am I interested in? What can I build on? You need to start doing that now. And of course, with skill set, it means you need to have an idea of what you are interested in. So first, you want to ask the question, what am I interested in? If someone was to wake me up at 3 a.m. to say, come and do this job, would I be happy? Would I be happy? Would I feel motivated to get that work done? Right? Start from there to figure out what you would love to do. Pharmacy is very diverse. So, what aspect of pharmacy are you interested in? I think before now, would say, oh, there is the retail pharmacy, I'm going to hospital, I'm going to production, I want to work with the likes of Emzor, I want to go to, hospital pharmacy. It sounded so boring, or I wanted to go to academia. But, right now, there's so many opportunities. There are startup companies that are utilizing pharmacies, and you're working in your own field. There are a lot of organizations that are now coming up. As I said, I think what happened, and which was very good for Africa, is that 2020, which is the pandemic year, sort of took us through a 5-year jump. So where we are right now perhaps would have been where we would have been 5 years, because right now, as you all know, there's a lot of awareness around technology and what technology can do in healthcare specifically. So there's so many opportunities right there. You don't, even within the pharmacy space, when you say retail, there's so many things that you can do within retail, right? There's e-commerce that people are bringing up great platforms to help connect patients to medicines and to the care they need without even physically meeting them. We're hearing of telemedicine. It's a different aspect. So even the traditional, units that we had, so hospital, retail, it's morphing into so many other things. Even in hospital, there are a lot of innovations. So figure out first, what are my interests? Where do my interests lie? What do I need to do? What are the things that I want to do? If I was to wake up at 1 a.m. to do a task or to deliver on a KPI or a job, would I be happy doing this? Would I be happy doing that? And it's okay as well if you don't know what you want to do, right? You want to try this, you want to try that. That's absolutely fine, right? But you must have a plan to say, I'll go into retail for this period of time. I'll go into perhaps I want to work with a pharma company, right? And for this period of time, there has to be a structured plan, right? You can't just live your life as is. You have to have a structured plan. Your skill sets that you're developing needs to also follow the plan. So if you're going to go into retail, you want to take courses that are aligned with that, right? Those things are very, very critical and very, very important as well. So just moving on from skill sets and how you will deliver, passion is the third and most important thing. I'll tell you, especially in Nigeria, you know what they say, living in Nigeria is not for the faint-hearted. Like, you literally need to be very, very strong, physically, mentally, emotionally, to live in a country like Nigeria or to live in Africa, because it's extremely challenging. However, as I mentioned, there are huge, immense opportunities. The opportunities are so much in this country. The opportunities are so much in Africa. There are a lot of organizations. There are a lot of people doing great things. So there are a lot of opportunities, even though it's in a challenging economy, I must say. However, passion is very critical to help drive you, because if you don't have the passion, trust me, even if you have a great job, even if you feel like you're doing well, you would just not be happy and you won't be able to continue, because you would always find obstacles. And sometimes when I talk to new recruits at Pharma, I always tell them, the first thing I tell them is, if we had figured out all the problems at Pharma, we would not be hiring you. That's the honest truth. If we had figured out all the problems, if we had artificial intelligence doing everything, if we had systems in place and we didn't need, like a demand planner, so why would we want to hire you? Do you see? So there will always be needs, right? There will always be problems to solve. And we have an immense opportunity here to solve those problems, which is absolutely very, very key. So the passion that you have for what you do, the passion of being a pharmacist, the passion of loving to connect, communities, connect patients with quality and affordable medicines. That passion must shine through in your everyday activities, what you do, when you talk to people. You must be passionate about even coming to work every day. If you're working as a trainee or you're just starting out in any organization, are you passionate? Are you showing your passion, right? If your boss just gives you some tasks to do, how do you even approach the task? Are you approaching it like, if as people would say, the lazy youths? Are you like, oh, okay, well, my boss has just given me a task. Are you slowly just making your way through with no drive, no energy? No one is going to want to hire you if you're not, physically charged to work, especially when you are new in the workplace, right? People would carry on the stress of coming to work on their head. But when you get to work, it's game on. You have to have a different perception of how you're carrying out your work, how you're interacting with other people. Use the opportunity to network, talk to others who are in the organization about their roles, about their position, what they're doing, so that it can then inform you if that sort of activity or that role is something that you are interested in. That passion is what will drive you. Without passion, you will not be able to achieve anything. And when you find obstacles, there is no light. I'm sure perhaps we would have had 100 people on this call, perhaps, but we have only 32. You can imagine what happened to the 67 others. Perhaps it was electricity, perhaps they didn't have data, perhaps they had data, but there was just no connecting, right? There's so many challenges, but however, that passion is what will take you through and what will see you to the next step. So just round up on this must-haves, and for us to go into the the Q&A session, I just really wanted to point out that, as I said, being a pharmacist is a wonderful thing. I think for me, if I think back, I wanted to be a doctor. So actually, when I got pharmacy, I was not happy. Actually, my dad is an orthopedic surgeon, and he's a graduate from Oxford University. So I always wanted to be a doctor. I always wanted to be like my dad. Even my dad as well was always like, yes, you're going to be a doctor like me. So it was quite disappointing when I didn't make the cutoff in JAM and I didn't get to be one of the medical students, in quotes, right? When I got pharmacy, and I felt like even my dad himself was a bit disappointed, but he was like, well, do you want to try JAM again? I was like, no, definitely not. I'm going to go through with pharmacy since, it was my second choice, and I would see how it goes. And honestly, to be honest, I do not regret being in pharmacy because it is so dynamic. As a pharmacist, I get to work in any organization. I get to work in a hospital. I get to work in a health tech startup. I get to work in a tech organization. I get to work in just name it. Whatever, there are pharmacists that are working in Naimova, there are pharmacists that are working anywhere. The diversity alone, and I think with pharma, it also gives you that business angle. If a lot of you know medical doctors, you would agree that they are not business savvy. A lot of them don't know much about business because their profession is quite streamlined and they're not thinking about business. For them, it's okay, first do no harm, I need to make sure my patients are well, and all that goes with being a doctor, which is great. However, with pharmacy, we have that background of business, right? You're running a retail pharmacy. You have to be a very good business owner. If you're running a retail pharmacy in Nigeria, you are definitely a very good business owner because not only do you have insights into, hiring and recruiting, because you're recruiting farm techs, you're recruiting pharmacists, you're recruiting security guards, you're recruiting sales attendants, you are also managing your books, you have finance background as well. And then you have the healthcare, counseling, pharma counseling. Our profession is so diverse. That's what I'm just trying to say, that you can actually be involved in so many different areas and so many different opportunities, which is absolutely awesome. And for me, I could not. I think this was God's plan, and His plan is always perfect. So I definitely I'm so happy that I'm a pharmacist, especially with the opportunities that are coming on. So I will just stop there, just so that we can touch on some of the questions that some of us may have. Ahmed, I'll hand over to you for Q&A.
Yeah, thank you very much, man. That was really exhausting, and it was really enlightening. So we have a couple of questions, right? But before I go into that, I personally also have like a couple of questions. And I like the fact that you touched on some of the things that were my own thoughts when I got into pharmacy. So a couple of us we had similar story. We all wanted to do medicine, then we got pharmacy. And you see some people still like try to go back. But one of the things I realized early on, in 200, 300 level, was that this is a field that is very diverse, and it sort of like train you on so many things that you basically can like fly when you are done, and you can just put your hands in whatever it is you want to like get and do. But then it's also very, very interesting that when you talk to like pharmacists in the field, they just sort of like sound how will I put it, kind of depressing and not like really motivated, right? Especially when you go for all those sideways in 300 level and you meet some pharmacists in the community pharmacy that you work in and all of that, and you just like, this man is not happy, or the way the pharmacist is talking that, oh, they are paying us so low, this is blah blah blah. He's not just so happy with his job. So that really, really got me confused. So what I want to know is that from school to your master's in public health, and then back in tech to sort of like handle retail and now chief of staff, how exactly has that journey, like how did you walk through that? Because again, when I think about it, tech is an enabler, right? But when you talk about tech, most people are thinking you have to code. You have to code. And one of the things I've realized is that the dev part or the development part of tech is not even up to like 50%. There are a whole lot of other things that come into tech. There's tech sales, there's customer success, there's people's operation, there's marketing, and a whole lot of other places that as a pharmacist or as a pharmacy student, you basically sort of like have some inherent skills that can actually make you survive in that particular aspect. And people are thinking about, you always have to code, you have to learn this, you have to learn that. So I want you to like touch more on that and all of those other opportunities that are actually in tech that people are not sort of looking towards, and they should actually be looking toward that.
Thank you very much for that question, Ahmed. I think, honestly, you answered a great part of that question, even with your responses. But I'll just start with what you said about how depressing it can be when you work with, you as Cyrus, as you mentioned, you work in some retail pharmacies, and you can already see that you can't see the pathway, or you can't see a future, right? I think what I've come to see is that the mindset of people is very important. That's why I started by challenging you all to say that the Nigerian pharma industry is worth $1.5 million. Guys, what are you going to do about that, right? Where is your mindset? You cannot have a mindset of, oh, we know that the country is challenging, right? But then it's in the same country, people are making millions of dollars. So why should you be any different, right? Do they have two heads? Did they not? For a lot of them, they're not even as well educated as we are. I mean, pharmacy school, you go 5 years, you then have that mandatory internship that is another year, 6 years of your life. So the mindset is very important. I even at my previous role as a head of retail for Pharma, I worked with a lot of retail pharmacies, and they are so when I speak to pharmacy MDs, because in that role, when I manage the sales team, we're speaking directly to pharmacy MDs, so the owners of the pharmacy. And for a lot of those owners, a lot of them are middle-aged, fine, but we do see quite a number of the younger ones, so those in their early 30s who have just started running retail pharmacies. The mindset plays a critical role. The much older pharmacy MDs do not understand what it means by partnerships. And that is one thing that you need to survive, especially in a challenging economy. You cannot do it all on your own. You just cannot. As a business owner, as a young professional, you need to network with people. You need to know what is going on out there. You need to get yourself ready. That's why I asked that question. Are you ready? You need to be able to do all those things to take you to the next step. You can't wait for things to fall into your laps. It doesn't work that way. Even if your father is Dangote, and you can't, I can imagine that Dangote's children are very well learned, and they have elevator pitches, and they speak to people, and they network, and they're doing very well despite the fact that their father has money, right? So the mindset is very key. We all talk about SWOT, right? So do a SWOT analysis of yourself. What are your strengths? What are your weaknesses? What are your opportunities? What are the threats around you, right? What are the threats? Could it be that perhaps you want to do a master's but you have no money? That is a threat. So look around and say, okay, I have this strength. What can I do to amplify this? I have this weakness. What courses do I need to take to work on this? Perhaps I'm not good at public speaking. I go on Allison. There's a free course on public speaking. I take that course and I'm working on myself months and months, and I'm practicing and rehearsing in front of the mirror. The mindset is very important. What I see is that a lot of pharmacy owners don't have that mindset of partnership. They don't want to work with other companies because they feel, oh, someone is going to come and take my business. Oh, how are you going to, you have a contract that clearly tells you this and this and this, but you're reading the contract backwards because your mindset is in a different dimension, right? So that is what happens. Meanwhile, you see younger people, or you see even older people who are doing very well because they're embracing partnerships, they're embracing new ideas, they're trying out new things. The way retail pharmacy was run in 1935, it is not the way retail pharmacy will be run in 2026. It can never be the same way because the generation of customers you're going to have will be different. Our generation right now, people need things like yesterday. People need things like right now. People want things to be more affordable. People want things to come to them easily. There is the metaverse. I'm sure a lot of you already know what is going on with Facebook and the metaverse and blockchain. There's so many things going on. So you cannot expect retail pharmacy to be run the same way it was run over 50-20 years ago. So a lot of people have refused to accept the fact that things are changing and they need to go along with the line and find a way in which healthcare can morph. That is why they are still where they are. That is why they are struggling with the profession. That is why they are not innovating and they are still earning what they're earning because they have not changed their mindset and they have not accepted that the pharma space more than ever is changing and the healthcare space is different and it will continue to be different. So that's the first thing. The mindset needs to change. With respect to my journey, I think for me, what worked for me, which I really value, was that right after school and my internship, I went to work with a pharma company. So I worked immediately. I worked with Sanofi. I worked for about 2.5 years before I went for my master's. What that did was it just gave me an understanding of, number one, the pharma space. Before that, even when I was doing my NYC, I worked at retail. I worked at Medvac Pharmacy. I was managing one of their branches then for just about a year, really. And I just sort of got a little insight into, what this space is, what retail is, what hospital is. My internship was in Louth. So I had just a taste of it all, right? And it just made me realize, okay, my sort of person, when I look at my strengths, I love talking to people. I was quite comfortable around people. I love to question ideas. I loved innovation. I love to think through how things can be done differently. And pharma, for me at that time, was a great opportunity. So I went into pharma. I worked with Sanofi for 2.5 years as a medical representative. And for me, that opened up a lot. It helped me build a lot of skill sets. Even as at that, I was working on myself. I took so many classes. It was not your typical, like, oh, just sit down, or oh, I'm just going to work. I was not that kind of person, right? And it really helped me because I always kept challenging myself. What can I do? And right after just 2.5 years, when I realized I wanted to do a master's degree, and I decided I wanted to continue to remain in healthcare. So I wanted to do public health because for me, a lot of my passion really is to see how, we can get people, get patients, get Africans especially to access quality and affordable medicine, especially the underserved populations, right? And for me, I knew public health was the answer to that. So I did the applications, I applied. That is another story entirely as how I got into Emory, because Emory is a prestigious university, is one of the top 10 universities in the world for public health. It is another story entirely how I got into the CDC, because even when I got into Emory and we had the orientation, then I remember talking to one of the international students. I think she was from India, and she said, like, working in CDC, it's almost impossible for international students. Like, if you are an international student, you have no time. Like, it's almost impossible. And I can really see why, because even it took over 3 months for them to run a background check. They literally asked me everything. Like, I feel like they must have gone to my mother's village, right? So I can understand why, but it happened. So I'm just someone who came all the way from Lagos, Nigeria, who schooled in Unilag and got this huge opportunity to go to Emory University, and then got this huge opportunity to work at CDC, and then got a huge opportunity to work in the office of the director at CDC. Guys, anything is possible. Just set your mind. I had no connections. I don't know anyone. Even the people that I know do not have contacts at CDC. It was just ensuring that, God's grace, number one, because God, for me, has been that resource. Without him, I am nothing. So I give him the glory first. And then after that, I made sure, when I talked about your brand, packaging yourself, I had a strong resume, even at Emory. I had a very strong resume. When I had the interviews with the recruitment, the lady that recruited was a white lady. I was able to stand my ground. I was able to talk about my experiences. So I think that having some experience is one of the things that I would advise. Don't just leave school and rush to do a master's. You don't know what you want to do. You're rushing to do an MBA. You're rushing to do, like, people do masters and it's like it's useless to them because they come back and it's like you don't know anything still, even with your masters. I see them when I recruit people for different positions. Your masters does not necessarily give you that automatic acceptance into a position. It doesn't necessarily do that. It's your experiences that would help. That's why sometimes you find people hiring someone who is very skilled and may not have a master's degree, but someone who does not have a master's degree and is highly skilled, and they're hiring that person. So for me, that is one thing that helped. I worked for 2.5 years before I did my master's. Even when I engaged with professors, when I networked, I had something to say. I wasn't just this fresh student with like nothing to say and very shy and I couldn't network. After 2.5 years, I was able to hold my own ground. So that is one advice that I would give that worked for me. I did some work experience before I went to do a master's. And right after I did my master's, I knew what I wanted to do. Again, there are opportunities in this country. There are opportunities in Africa, right? I lived in the US. It was an amazing experience. However, I could be a billionaire in Nigeria, right? But it would take me several years, trust me, to be a billionaire in the US. Several years. Except maybe you win the lottery. You can win the American lottery, perhaps, and then win like $1 million or $100 million, and you hit those jackpots, maybe. But like it's guy, you go walk, It's not easy. But here in Africa, you can just get a startup and you hit it off. I mean, what's the name of this this organization that sold the name just skipped my head. They sold their startup for millions of dollars. I mean,
Stripe.
Exactly.
No,
Paystack, exactly. They sold their company to Stripe. Thank you, Ahmed. So I mean, those guys were just simple guys. They're just simple guys. They had tech. And they're like, right now, you can't even just see them like that. You can't see them. Guys have changed levels. And so many other businesses as well, so many other startups you don't know, getting millions and millions of dollars. If you are in Canada and you are in America, who's going to be giving you millions of dollars for which startup, please? They've solved half of their problems there. So you just batch in and you just do it. So, and again, I'm not against traveling, but what I'm saying is that there are opportunities here. So there, as Ahmed said, just run up on that question. There's several opportunities in health tech. You don't have to code. I couldn't even write a single line of code to save my life. And I learned coding in Emory, actually. There's a biostatistics class and I learned coding. And I got an A in that class. But after that, that was the end. Because number one, it's not my strength. Again, I said, know your strength, your weaknesses. My strength is talking to people. My strength, I have so much knowledge that I can share to people. I can get people I know my strengths. At Rebirth Careers, I had coached someone who is an alumni actually from Unilag. He did biochemistry. He wasn't even a pharmacist. He did biochemistry, and We worked together to build, like when he came in, his resume was just like terrible. We worked together, we built his resume, worked on his interview skills, and he landed a job at Conga Health. And this was so, and he didn't just land, like he landed a junior manager level role. So those are the things I'm good at. I'm not good at coding, right? But as Ahmed said, in an organization, there are different units. As he said, that cost, like he answered the question, there's customer service, there's supply chain. Supply chain is also another awesome opportunity, especially for pharma, for those of us in pharmacy. And in any country, in the UK, I'm sure you all know what happened last year with the whole supply chain crisis that they had. They're looking for supply chain professionals in the UK. They're like if you have a supply chain certificate, you can actually even get a virtual position and be earning in pounds, working here from Nigeria for a company in the UK. There's so many opportunities. So you just need to know where your strengths are. Are you someone who likes interfacing with other people? Perhaps you can be in sales. You could be in business development, where you're developing businesses. You could be in strategy. Strategy is an important part of tech as well. If you're someone who likes to code, who likes data, likes to analyze data, you can, before I go into the coding part and the tech part, which is very specialized, you can also learn to be a data scientist. We have people at Pharma who work with data, right? They're the ones that set our demand planning files. They're the ones that use, and just using Excel, having the skill set to manipulate data, filter data, clean data, and give that information to management, for management to use. For example, if I have 500 pharmacies, right, and they are ordering Galvos, right, and I see that in the data every month, every quarter or second quarter, there is a spike, right, in the demand. I can then say, okay, based on this data, we want to buy more Galvos for April next year, because the data has shown that this and this and that. So data analysis is a very interesting aspect as well, where you're working with pharma or healthcare data, and you're analyzing those data and using it to provide solutions for management decision. And the last part is the tech aspect, where you are actually the ones doing the code. So, for example, when you think about telemedicine, when you think about iChats, like they're the ones building all those. If I want to speak to a healthcare personnel, I can actually speak to a chatbot, right? I can speak to a chatbot who can walk me through all the different areas. What's your age? What's your this? Okay, how long have you noticed the symptoms? This is AI, artificial intelligence. So, especially in situations where there is no access to healthcare, there's no access to a healthcare professional at that point, people can actually talk to a chatbot. They can talk with their robots. They can talk to them because of the artificial intelligence. The robot can walk through the different phases. The robots can then determine, based on the responses that the patient had given, what particular drug, what particular counseling, or refer them for further counseling if it's a certain, maybe if it's a certain category of need that needs to have a doctor. And that could reduce the patient to doctor or patient to pharmacy ratio, the huge ratio that we're seeing in Africa. So that's artificial intelligence. If you're someone who likes to write codes and build those sorts of interfaces for healthcare, then you can learn how to write codes. It's not too late. There are schools like Aptech, for example, where you can go and in 2 years you can have an advanced diploma in software engineering, I think it's called. And you can be a software engineer and they're very well paid. So there's so many opportunities. I'll just stop there, Ahmed, so that we can go ahead with more questions.
Yeah, thank you so much, man. I mean, that was really insightful, because you answered most of the question. So a couple of the questions we have here, you've actually answered some of them in the course of your presentation. But there is one particular one that's a little bit specific that I want to touch a little bit on. So the question says, what challenges did you face in your transition from pharma proper to health tech, and how did you overcome those challenges? Or what are those things you wish you knew when you were actually transitioning?
I think for me, what really worked was having a good network. I think my transition to health tech it was not, to be honest, it was not difficult. I didn't struggle like um, perhaps quite a number of people would have. Could it be that I had a strong resume? Could it be that I had a very strong elevator pitch? Could it be that I was very good at writing cover letters? It helped me, certainly helped me. When I came back from the US to Nigeria, M Pharma was the first company that I applied to. Like, based on my work at CDC, there was an opportunity to go to Abuja then, because you have the CDC in Abuja, but I didn't want to be in Abuja. I wanted to be in Lagos. I was thinking about it, but I said, okay, let me just apply and see what's out there. I wanted to work for consulting, Deloitte, and the likes, but I had not even applied to them. Enfam was the first company I applied, and then I got accepted to work with them to build their Nigerian operation. So to be honest, I didn't struggle, but then again, as I said, I was quite prepared. So for those of you who may not be prepared, as I said, in this must have the top three, there are things that you need to do. If you're not doing all those things already, you are going to struggle. You are going to struggle, except maybe you have someone somewhere who can just send a message and then they call you for an interview. And even if you go there and say rubbish, they'll tell you, yeah, you've done well. I think you're just what we're looking for. And they hire you. So except you have that level of connections. But if you don't have that level of connections, you need to make sure that this must-haves, you have them, because that is what will make the difference. Again, you're networking, you're looking at your brand, you have your resume, you have yourself well packaged. Are you able to talk about yourself, your interest to people? Again, you don't need to have a lot of experience to do all these things. What skill sets do you have? Excel now, you don't even to be a data analyst, you can start as a junior data analyst just by knowing Excel and having very good Excel skills. And that you can learn for free on Allison. You can learn for free on YouTube. So as I said, there's no excuse. You need to have that passion as well to drive you on what you want to do. But there's so many opportunities. You only just need to know, okay, where do I want to fall in? How do I position and prepare myself? And it's okay if you can't. Some of us struggle with some of these things. You can ask for help. There are people that you can go to. You can go to YouTube. Like, you don't even need to go and pay money to anyone. Everything is on YouTube. Go and learn, right? But there's no excuse not to be prepared, not to have these three things. Because again, if you're not passionate about healthcare, no matter how you package yourself, you just will not be feeling. You won't be happy. So some people might just want to do some people might just want to do something else, and it's okay. It's okay. You might want to be a musician. You might want to, start up a school for people who maybe have a learning disorder, whatever it is. As long as you are happy, again, as long as if they wake you up at 1 a.m. they say, Ahmed, come and do this work, and you wake up happy, even though you know that you are still sleepy, then you're on the right track. But if you're not happy, if you are grumpy, or if you are shedding tears, then perhaps it's not the right thing for you. So these three things, I think, I'm preaching. These three things, I think it's absolutely important to get you ready for those opportunities to transition into health tech. You can transition. If you're going into the specialized part of it, that means you are coding and you're building those tech resources in tech organization. Then you would have to actually do some specialization where, as I mentioned, app tech, right? The other school, I think there's NIIT, I think it's called, which is a cheaper version of app tech. You can actually go and learn some of these things, and then put yourself, do a part-time job, make some money, put that in, go through the school. Do you understand? You don't need to bug your parents for money. Get a part-time job, do this. Their schedules are quite flexible. Learn how to develop codes and all, and then get a part-time job. Get yourself in, transition into a health tech company. But if you're not in the tech code writing side, there are different aspects. There are operations, as I said, operations, business strategy, the business development. There's the health part of it as well. Key accounts, pharmacy service associate, where you are interfacing with healthcare professionals. And there's so many opportunities. Right now, the current trends are showing artificial intelligence. As I mentioned, chatbots in healthcare. I think that that's going to be one of the biggest things coming up, because where you have telemedicine right now, That's where you can actually talk to a doctor from anywhere. You don't have to be in the physical medical space. You can chat with a doctor. They can do a prescription for you, and then you can have your drugs delivered to you all in your house, right? There's also opportunities in the insurance bit, because a lot of people are not insured. Did you know that 70% account for out-of-pocket spending in Nigeria when it comes to healthcare? 70% compared to South Africa. South Africa is just 7%, 7% South Africa, but Nigeria was 70%. So tell me why it is not exciting to be a pharmacist right now. If somebody is spending money, even I have insurance. I have top insurance, but sometimes because of the stress of going to the hospital, I mean, you guys know, even the top hospitals, you wait. It's like they just waste your time. Like, it's just time wasting, right? And for me, my time is very important. So, like, if I feel, thank God I'm a pharmacist, if I have a headache, I know what to do. Like, I don't need to, even though I have health insurance that could actually cover it. I'm not going to go and spend 2 hours for a doctor to just prescribe ibuprofen and something. No way. I'd rather pray my way out of that headache, or take my money to the nearby pharmacy and buy what I need and go and do my job, right? I'm not going to go to the hospital and say, except something critical. Like in the last 2 years, I can't, I know I'm sick and stuff. So that's great, but I'm not like right now. I'm telling you, if I could actually talk to a doctor virtually, trust me, I would use my health insurance. I'll be calling the doctor. But for me to go into a physical space, it's time consuming. So that trend was in telemedicine, artificial intelligence. We're seeing a lot of, as I said, investors are investing in health tech startups. Start researching on the different health tech startups and looking at, I can just go on their page and look at roles they are hiring. Click on the job description, look at the skill set, what they're looking for. To give you an idea of some of the things you should be thinking about to package yourself. Go and check out the JD, check out what they're looking for. We need someone with Excel experience. We need someone who can do this. We need someone who can build businesses. How do you build business? I don't know. Who do I need to go on LinkedIn? Go and chat somebody. Go and chat about OGUNRO on LinkedIn. And ask that question. Oh, this. How do I do this? Why am I interested in this? Can you give me 5 minutes of your time to talk to me? I'm interested in this. You know, like network with people. Don't just sit down there spending 2 hours on Instagram or spending 1 hour looking at the fight between him and Kanye and what's that where peace, and then after that, I'm thinking, oh, my life. Meanwhile, Kim somewhere like run her Prada bag and living the life, and you are spending your data just checking out on them for 1 hour and 2 hours. I'm not saying Instagram is bad, but I mean, don't spend all your time and your money and your data going all that stuff. Like, go on YouTube and look at what is happening there. Learn some things. Like there's no limit to almost what you can learn on YouTube. You can learn how to cook. So even for people that say they can't cook, honestly, there's no excuse now, because you can learn how to make things. Just write by the end, follow it, and then you learn how to cook. So there's no excuse. Men and women, but not only women cook, men know how to cook as well. You can cook for your wife. So for both people, I mean, it's as easy as just going to YouTube, right?
Thank you very much. That was really good, because it touched on a whole lot of things that I'll have them to ask follow-up questions on. So just one more question, and I can just open the floor for everyone on the spot that have a question. So if you're on the phone and you have a question, you can just drop it on the chat box so she can answer them. I can follow very quickly. So in your previous role and in your current role, I know you talked about recruiting a lot of people, which means you're seeing young professionals now coming and you see like some people that they make mistakes, or some of the mistakes that they made, or they have that's actually making them to like progress and all of those sorts of things. You mentioned one of them that building experience is actually very, very important early on in your career. It's sort of like give you like this clearer view, clarity on what you actually want to do before you just jump out of school and then you're going for PhD or masters and just your life. Very wrong. Yeah. It doesn't happen to me. So what are those other major pitfalls that young professionals should avoid? That you've seen those mistakes that you've seen young professionals make that they should actually avoid, and can actually, when it's being avoided, it can actually impress their career progression. What are those major other major pitfalls that you've seen?
I think the first one I mentioned was doing a master's degree too early. You know, that's one of the mistakes I've seen. As I said, it's not about having a master's degree necessarily on your portfolio. It helps you, but it doesn't necessarily get you the job, or it doesn't necessarily get you the opportunities. What you learn in school, you still need to practicalize it. So have that experience, at least 1 year experience, to help you just figure out whatever you want to do, right? Before you jump into doing a second degree. Okay, it could be a master's, it could be whatever, a second degree, because right now you have a first degree, right? So take that time to study the industry, take that time to, get into the workforce, doing something. It just not only makes you more mature, it helps you fine tune a lot of things. That year, you can usually take on more courses, you can usually do a lot. That can help you. That's one mistake I see a lot of people make. The second mistake is not being prepared. I touched about that lot. I will not go into that. So I mean, if you've been on this call and you don't know what I mean by not being prepared, then you're probably being asleep, which is quite disappointing. But so being prepared is it's a major mistake that a lot of people make. They're not prepared when it's not easy. I mean, for example, I've seen a country that came and applied, and they didn't even know about NEXT. Like seriously. Seriously, you're applying to a company and you don't really know what we do. Like, don't you have data on your phone? And the same person, if you ask them, for the guys that are above, I'm not really a football person, but if you ask them about Barcelona or Arsenal, like, they will break it down. They will tell you everything. If you ask the ladies about what can I say about the ladies? The ladies fashion trend or hair trend or like basic feelings or whatever it is, like they will break it down to you. But you are applying for a job and you don't know, haven't gone to research the company or even go. Like they gave you a JD, but you still don't know what they're asking you to do. It's a terrible mistake to make. So it's also tied to not being prepared. You must always be prepared for whatever it is. And you can only be prepared when you research. So again, if you have 12 gig of data, you advisor use 11 gig to better yourself. Then the other 1 gig, you can then go on Instablog, news and times, research. But then let's use the 11 gig to improve on yourself. Trust me, it's more valuable. It's more valuable because the people that make Instagram, they're cashing in, they're billionaires. So I mean, or people that are behind Facebook, Mark Zuckerberg, multi-billionaire, So he's doing the work, but he's doing very well. So you are just starting out. You also need to do your work and do very well. But it means that you need to use your time very wisely. So I think I will just tie into that. Another common mistake is following the crowd. Everyone is going into health tech, and then you want to follow the crowd. Or let me do this. If you're not, again, it goes back to your SWOT. If you don't know what your weakness is, if you don't know what opportunities are there for you, if you don't know what threats are there, if you don't even know your strength, if you don't analyze this thing, you're following somebody else that's doing this and that person is going to work for this person is doing. You are not living your life for anyone else. And you're not following. Sometimes when you think about disruptive innovations, it does not follow the common rule. Like everyone is going this way, but disruptive innovation goes the other way, right? So don't follow the crowd. Analyze yourself to know what you're good at, leverage on your strengths, work on your weaknesses, look at what opportunities you have, and that means moving with the right people as well. If your friends are not helping you, then they shouldn't be your friend, right? So I have a question here. What's your advice for someone that doesn't really have passion or take a job or so long job? What can the person do? I think it ties down to what I said. Sometimes we are taking a job out of fear. So it means what I read here is that whoever that person is, maybe afraid, oh, I need to get a job, I need to make money. And sometimes we support our parents, we support our siblings. It's not easy. Some of us here, are practically breadwinners of our family, and well done. Well done for your strength. Well done for how brave you are. You shouldn't have to do it, but you're doing it. And you're doing a great job, right? But sometimes we find ourselves in situations because we want to make money. Have a time frame for yourself. Again, if you hate a job, you're not going to. It's just a matter of time. It will show. It will show because it's difficult to fix something that you don't like, even though it's tiring. It's tiring. And those are the things that get people depressed and all. So just think about, have a game plan, even if you're working at a place where perhaps you're doing it because it's a sort of livelihood. Have a transition plan. You can have a part-time job. Again, the opportunities. It's the end that matters. Right now, you're so young. You're so young and it's an amazing opportunity. As I said at the beginning of my talk, in 20 years from now, add 20 years to your age right now, it's going to be much more difficult to achieve what you can achieve right now. So you need to figure it out very quickly. You need to take the time to have a plan. It's okay if you're in a job where you don't like, but you have to have a plan to transition out of that job to do something that you love. And trust me, it doesn't have to have healthcare. Healthcare is not necessarily for everyone. You can make a lot of money doing other things. There are people that are so skilled. I'm sure you guys heard about this lady that uses tires. I'm sure you have seen her. They talk about her a lot on Instagram. She uses tires. She picks tires out of the street. She paints them. I've forgotten what her handle is, but she makes them into like center tables. You need to see the crazy stuff she's doing. I've also seen another lady who went to school for something else, but what she's doing is she makes like bespoke, like different African themed furniture. Excellent stuff. And these people are cashing in. And she loves what she's doing. So you don't just because you have a pharmacy degree doesn't necessarily mean you need to be in healthcare. Think outside the box. I think there's another there's another question here. You talk about having at least 1 year experience as it helps give you insight on what you want. If a person tries to get experience in a community pharmacy and he or she no, this is not for me, and goes to another aspect and still is not seeing himself or herself there, then this person has to keep trying every other aspect to know which it can fit in. And is this not wasting time? So it just ties back to what I said. It's a good question, but it ties back to what I said about SWOT. What are your strengths? Again, when you think about community pharmacy, you are interfacing with people, right? So you'll be seeing patients, you'll be dispensing drugs, you'll be counseling, providing pharmaceutical care. If you don't like that sort of front end stuff, then what do you like? You understand? You need to analyze yourself. What are the things you like? What are your strengths? What do you love doing? What are some of the ideas you have? Are you a business person? Perhaps you could go into the business aspect what you're working with. I mean, there are people who build like, I'm sure some of you have heard of Keeper, which is a bookkeeping app. Like they build for small businesses. What about building an app that can help retail pharmacies? What about getting an idea? Like I won't give out all these really nice ideas for you guys have to pay me to give out some of these ideas. But when you think about healthcare, what about the apps that exist? Even in retail, and what can you do to solve those gaps, right? Think about that. It's not about going to different places, work on here. What are your strengths? What do you like? You have to first analyze yourself. Okay, what are the things that will wake you up in the morning? There must be something. Then you can start building it from there. So, for example, if you're someone that likes back end work, that means you don't necessarily like talking to patients. Why back end work? Potentially, you could work in an organization where you're working back end, maybe a pharma organization where you're not interfacing with people. You wouldn't want to take a job as a medical rep. You may not want to take a job as a retail pharmacist because it will involve you interfacing with people, and you don't like that. So you don't want to do things like that you like. You want to look at the back end and research. Again, look at JDs and see what organizations are looking for, right? And then that can give you a guide so that you don't, as you said, have to waste your time going to different aspects. And then at the end of the day, you just figure out that you don't like any of those things. It is wasting your time. All right, I think those are the two questions. I mean,
Thank you very much, ma'am. So I have one for the question from someone here.
Okay.
It says, what are the benefits of having a first class? I mean, you know, normally is really asking.
Yeah.
To read a lot of courses and
Yeah.
So you see people that are changing this academic excellence, they have to like put their all in, and that's sort of like steal some of their time that they could actually use to develop some of the skills that are actually needed, right? So the person is asking, is there actually is there actually an immediate relevance to actually having a class on pharmacy?
Unfortunately, no, not in our world. Because if I interview someone, okay, let me paint a scenario for you. Let me take, I'll just call on two names. Let me take Aminat. Okay, Jonathan has his video on, so I'll take Jonathan. Let me take Aminat and Jonathan, right? Aminat graduates with a first class degree. She's very smart. She comes to us, but she's not very outspoken. She could not really, I don't know, defend herself. She couldn't really add much value, more booky. And then you have Jonathan who comes in as a tutu, you know. But the guy, like, he's read about INFERNO. He's even giving me ideas. Like, oh, you know, when I thought about INFERNO, I was thinking, could you guys potentially go into the insurance space? Could you guys potentially, what are your thoughts? You know, who do you think I would want to hire? It's a no-brainer. So, unfortunately, first class degree does not guarantee that you make. You know what they say now? When even first class degree say they make them. That's the joke. Like, first class degree, it's good on your CV. It can actually get you to be seen, but it doesn't guarantee that you get opportunities. If you can't network, it doesn't guarantee that you get opportunities because be a first class, but if you bring out a shitty resume and nobody wants to see it, you're not even going to get into the interview. And then if you are able to get a resume, but you can't even talk about your experiences or even talk about who you are, then unfortunately the first class will help. But in terms of academia, like if someone potentially wanted to go into PhD and wanted to go into research work, that could be a plus because with research work, with PhD, having a first class would be a double plus, right? But then you also need to show your interest. Like, what interest do I have, right, in this research area that I want to go to? You should also be able to defend that. But it makes it much easier, for example, if that person is going into academia, because in that case, it's more of a mental work, right? But then the interest again is there.
Yeah, thank you so much. I think that answers that first question. That's really been an insightful conversation. I personally agree with everything you said because most of the things you touched on, mindset, building a brand, building capability, building experience, and knowing your strengths. There are things that I personally have like leveraged on in my personal life, and has really helped me a lot.
Yeah.
It's helped me like get opportunities that I ordinarily wouldn't have gotten, but because I was like very early on know that, oh, I'm not a person that wants to do something that has interfacing with people. I prefer doing the back end job, doing my strategy, research and stuff. And I sort of like leverage on that and sort of like build that skill that's actually really helpful. So I sort of like agree with all of the things you mentioned. So just like a last parting one, putting all of these together, I just want to just like motivational statement for people that are still like trying to find where they belong to, what are things that they want to do, what are those tools, last time you want to give them to like hang on to.
Yeah, I mean, very well said. I think each and every one of you for your time. This has been very, very engaging. I really loved this sharing with you, and I must say that I'm just very thankful for the opportunity to have helped someone today, even if it's one person, to find clarity, to know where they want to go. In terms of parting words, I think what I would say is that still you may not be 100% certain on what you want to do. You may not be 100% certain on how you feel like you want to the next couple of years to be, and that's okay. Again, it just finishing school, being here shows that you are interested in knowing what your next steps would be, and it shows that you are interested in those opportunities that can take you to the next step. So that in its own is a wonderful start. What I would say is yourself, right? The first thing I would say is, in terms of that first question I asked, are you ready? That is the question you need to ask yourself. Are you ready? Because where you're going to is very competitive. It's going to require that you be able to prove yourself. You can't just go there. Back in the days, they say, oh, my father knows this man, and they connected me and got the job. But nowadays, there's a lot of competition. If you can't deliver, they'll ask you to go. Wherever you are, tech or no tech, you must be able to deliver. Even outside the country, you must be able to deliver. So even if you're starting your own business, you want to work with someone or hire someone who cannot deliver. They're just going to mess things up for you. So you need to, are you ready yourself? Start with yourself. And just really perform that SWOT analysis to find out where you're good at, just like Ahmed said. And that is the starting point for you. That has to be the starting point. You knowing what you're good at. You knowing what your weaknesses are. You knowing what opportunities are there for you. For those of us that come from, for those people that come from wealthy homes, perhaps it's an opportunity, right? Those who are from homes that may not be able to support you through masters, it may be a pay right? But it means that you are identifying it and you're saying, okay, if I want to do my master's in the next 6 years, my parents may not be able to afford it, but what can I do, right? It means that you're researching. They give scholarships. What are some of the criteria for scholarships? How can I get student loans? Student loans is another way. How can I get student loans to fund me? How can I write a strong statement, right? Because it's a statement that you write that will get people to want to know you, who want to interview you. Those are some of the things you are looking at. So when you identify your SWOT, you are then putting strategies. Okay, these are my strengths. How can I build my strengths? These are my weaknesses, my opportunities. How can I turn these strengths to opportunities? How can I make use of these opportunities? Right. So that's the first thing I would say in terms of passion. And the second and last thing I would say is that you must have a passion. If the passion is not there, trust me, especially in healthcare, it can be quite challenging because that the government does not allocate that much resources to healthcare. We have a lot of generation, what do you call them, generation disease, the older generations that are not tech savvy and they may not want to move our profession forward. Like you have people talking about telemedicine, and you'll be surprised that some of our older colleagues saying, "Oh, why do we want to bring doctors into the pharmacy? Why do we want to bring like they're just coming from this very archaic mindset." It's not to say that sometimes some aspect of our profession needs to be preserved, but then again, as I said, things are changing. Imagine where we'll be in 2040. Just think about it. I doubt if the pharmacy profession will be the same in the next 20 something plus years. Do you see what I'm saying? What about the next 100 years? Do you think it'll be the same? We probably have drones and stuff going to deliver stuff. Like, who knows? But we need to be ahead of the trend. We need to work towards that. We can't keep sitting in that mindset, right? So that passion for healthcare needs to shine you. That passion that will drive you Every time you are going out there, every time you're going to work, every time you're pushing, it doesn't happen. Rome was not built in one day, right? So even after this call, you're going to go back to your realities. But one thing you should take is that if you have a dream, it can be actualized. If you have a dream, it can come true. You have the power to make that dream come true, and it's in what you do. Like Bible says, what works is dead. You can't keep saying, "Oh, this is how you're praying and you're not doing anything." Again, there are lots of favorite resources. There are lots of opportunities. If you don't have that much in terms of funding and resources, get a part-time job. Don't be doing something good and decent, and then just get the money and invest it in yourself. So that's what I would say. Ahmed, thank you again for this.
Thank you very, very much, man. Really, really appreciate you. A very enlightening and interesting conversation.
You're welcome.
And I'm sure that a lot of us will actually like take to most of the things we've talked about and try to use them to ourselves in terms of gaining clarity on what are the things that we want to do with our life in the next few months and years, right? So I just wanted to ask that a couple of us, there are some of us that they are trying to like get into the space, like the coding aspect or the development aspect of some of all these other non-tech roles. And one thing I've get is that it's actually quite a little bit very hard to get internship opportunities. I don't know if you know, currently we are on the second month of a 3-month strike. So a lot of us are not like doing a lot of things right now. So I would like to know if there are like internship opportunities currently at NFarmer that some of us can plug into and sort of like use them to if hopefully I'm just like the next month.
Yeah. I mean, we do have opportunities, but we basically like to take people, well, not students, so professionals, people that have completed and gotten their degree. And right now, you're not there yet. So you would be able to do really is more of an intern work. It's not to say that we don't hire interns, but it's just very few because most times we're looking at those that are starting out at the training level. So at the training level, you are done with school. You are NYC, taking NYC now, which is great. So NYC sort of opportunities, NYC pharmacies, we hired a few. Those that are done with their internships. Those are some of the opportunities we have. But we have 1 or 2 slots for interns, but it's not a lot. But again, it's on how you package yourself. How you going to go about it. 10 of you may be interested in that, but only the person who is able to leverage quite a number of the things that I said is likely to get such a position. I think I mentioned immensely on how you can get yourself ready to get those sort of opportunities. They're all there. So it's not just pharma. There are other tech startups, health tech startups as well that are there. What are you doing about it? Are you now the people who have a CV, have a resume? What do you have? Are you able to go through the interview? Are you able to talk to people, network? What are the things that you are doing? It's just not going to fall on your laps. So how are you approaching that? Those are the things that you need to think about and ensure that you are doing position yourself to get those sort of opportunities.
Thank you so much for that. That's really helpful. So, in the absence of no other question, I guess we have come to the end of this session. I'm really, really thankful that you honored our invitation and you came on this call to sort of motivate us, teach us, coach us, and help us like know actually how to think about about our career progression. We are really, really grateful and thank you so much, Ma.
You're very welcome. Thank you to your team ahead for organizing this. It's definitely a very wonderful one. Well done to your ESCOs. And I wish everyone the best. This is really, thank you, Krista. Thank you to everyone for your time. It's very, very valuable. And yeah, so soon. Bye everyone. Thank you, Khadija.